Hi, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment, which is the inside part of your knee. And as we're looking, we're using this instrument here called a shaver. You can see how it's got a central cutter that spins around. We're not cutting anything right now. We're just using the suction just to help wash out the knee. In this medial compartment, we can see the meniscus. We can see the meniscocapsular junction. And this is a pretty good-looking medial compartment in the knee. So I'm kind of happy with the way this looks. I don't see any significant cartilage injury. The meniscus here looks pretty good. I'm just getting a look around posterior here. As we pull back a little bit and look at the femoral condyle up above, we can get a pretty good idea of what this compartment looks like. And again, this looks pretty good. So now we're going to move to the central part of the knee. This is called the notch. Two big ligaments here. Here's the anterior cruciate ligament. Again, we're not really shaving anything. We're just looking. It's a structure called the ligamentum here that sometimes blocks our vision. Sometimes we can remove it so we can see a little bit better, like right there. And now we can see the ACL pretty well here. This is running up to the lateral aspect of the notch here, and that looks pretty good. It's under pretty good tension. That's a pretty good looking anterior cruciate ligament right there. The posterior cruciate ligament is going to be behind this tissue right here. And that looks pretty good. So we're going to go off on the video for just a minute. Okay, so now we're in the lateral compartment. So this is the lateral meniscus over here. We're still running a bunch of salt water through the knee. And the articular surfaces here look pretty good. Posterior horn looks good, stable. With your right hand, Vern, push down on her knee. And as we open up the compartment, we can see the anatomy here looks pretty good. Popliteus tendons back there on the left, right there. That's popliteus tendon. And this meniscus is really in pretty good shape here. Okay, so now we're going to look at the patella. Okay, so now we're in the patellofemoral joint. This right here below the shaver is the trochlea. This is the distal femoral condyle here, distal part of the femur. And as we follow this down the front of the knee, we can track it all the way down to the anterior cruciate ligament. We can see that this cartilage is nice and smooth all the way down. So I'm happy with the way that looks. Put my pressure up about 10. Yeah. Okay. And I should mention we harvested some bone marrow without any problems, and we were able to make a nice bone marrow concentrate injection, which we're going to be using at the end of the case. This is the medial gutter. Nothing to worry about there. We'll sneak over here down the lateral gutter. And there's nothing to worry about all the way back here. So the gutters look clear. And so now we're going to go to where we think the problem is, which is going to be on this medial patellar facet right here, right where the shaver is. Okay, you can see that little divot there. So we're going to have a look at that. I'm going to change positions with the scope. Okay, so now we've switched positions with the scope. The scope is on the medial side of the knee. The shaver that you see is coming in lateral. And I wanted to get a really good look at this medial patellar facet. So you can see that there. I don't see significant loss of cartilage here. I do see a little bit of thinning. This part of the cartilage feels pretty stable right now. And where it articulates is right in the middle right here. So I'm going to show you what that looks like in just a minute. So I just turn down the pressure a little bit. Watch that. And as we drop your knee and start to flex, you can start to get a sense of how that patella is articulating in the groove here. So that's with your knee flexed almost to 90 degrees. There's 90 degrees. So we can see there's not really anything in the groove. You've got that little bit of fraying cartilage lateral, and we're going to do our stem cell injection right there for sure. But I don't see anything else in the trochlea to worry about. Okay, so what we're going to do now, we're just fleshing out the rest of the knee. I think we're comfortable that this flap is not unstable at this point. This little fraying in the medial patellar facet, you can see I've got suction directly under it. And although I can trim it a little bit, which is what we're doing, I don't think that it's unstable. So we're going to do our stem cell injection, our bone marrow concentrate injection, that is, and then let you get out of here and get back to the recovery room and on the road to recovery. So this will be the end of the video, okay? Good luck to you now. Bye-bye.